Hi, thanks for coming and looking at Dr. Jeff Maritime Vet YouTube channel. I'm Dr. Jeff Goodall, a practicing veterinarian here in Bedford, Nova Scotia, Canada. I own medical director of Sunnyview Animal Care Center, a dog and cat practice, also some pocket pet, companion pet practice as well. The intent of this channel is to add substance to subjects that come up on the Rogers News 95.7 call-in show we do here once a month. Typically, there's just not enough time to add substance or depth to the answers of some of these questions. So I'm hoping to take this opportunity and share with you a little more depth on certain subjects. Really appreciate you taking the time to listen. If you like what you see, hit like and subscribe, of course. I'm new at this, so I'm learning editing and all the other things that go with it. So if you see something that's not to your liking, let me know. Also, too, of course, give me ideas for other subjects. I'd really appreciate that, too. I think that's everything. Why don't we just get into the show? I want to talk about parvovirus. Parvovirus seems to have resurged in Atlantic Canada. It's a very devastating virus. It will kill 20% of the patients that it infects. It's a dreaded disease, especially in puppies, and it'll typically get your puppy. We think it came back into the province through importation of dogs from the U.S. Nothing derogatory about the U.S., but customs on both the U.S. and the Canadian side don't require proof of vaccination and proof of effective vaccination of dogs crossing the border when it comes to parvovirus or distemper. They only worry about rabies. Rabies is a very serious disease, and I'll cover that in another YouTube video. But parvovirus and distemper, and especially as we're finding out, parvovirus is pretty serious. Without proper treatment, parvovirus can be fatal. It's so easily prevented through proper vaccination. It's so important just to have that annual consult with your veterinarian, with your pet present for an exam. And then between the two of you, get a feel for each other's background, each other's opinion, each other's direction. If you are the owner who does not want to vaccinate, let's have that conversation. If you're an owner who wants to maybe vaccinate too much, we should have that conversation as well. The problem with parvovirus is it's so severe, but so easily prevented. So let's go through what I'm going to talk about and hang into the end, and I'll list this for you to talk to your veterinarian about. But basically, and I am reading a little bit here because this is a complicated subject. I want to make sure I catch everything. So I'm going to talk about the development of the disease, how the animal contracts it, the symptoms, of course. I'll cover diagnostic testing, treatment, therapy, and the prognosis, which I've already sort of talked about, but we want to talk about sanitizing the environment, how to avoid it with your pet currently. Even if it's vaccinated, you want to avoid it. Then we'll talk about vaccination misconceptions, maybe, the value of titer testing, and take it from there. So parvovirus, it's actually called Canine Parvovirus type 2. It's been around since the 70s. A very effective vaccine was developed. And typically, parvo vaccine forms part of what some veterinarians refer to as core vaccination of parvo, distemper, and rabies. And that's all I'm really going to talk about today is the core vaccines highlighting parvovirus. Once parvovirus is in the environment, a dog will contract it by either direct contact with another dog who's carrying the disease, fomites, which are water bowls, common areas of drinking, fecal matter, areas where dogs have pooped even 7 years ago can have active virus in them. The virus is extremely hardy in the environment. It withstands freezing, thawing, and it's tough to get out of your home sometimes. Once it gets into your dog, it quickly moves from the nasal and oral cavity into the lymph nodes and spreads through the lymphatic system, which is part of your immune system. And the virus looks for rapidly developing cells, so the bone marrow, other cells, but particularly it goes after the gastrointestinal cells or the cells that line your bowel. It can also affect the heart, and that's important for the prognosis. Heart disease from or as a sequelae of parvovirus is called myocarditis, which is an inflammation or infection, depending on how you look at it, of the heart muscle. And some dogs who survive the actual virus can then succumb to the myocardial or heart infection. The dogs at risk, of course, are poorly vaccinated, newly vaccinated, puppies. Even if your puppy has been vaccinated once or twice, it's still at risk. So improperly vaccinated puppies, senior dogs, dogs who have not had their boosters updated recently or had their titers checked, dogs with weakened immune systems, dogs with immunocompromising disorders. There is discussion, and it's been going on since before I was actually in veterinary school, so in the 80s, and I still heard it when I worked out west. There's the German Parvo booster series, which is, coming back briefly to vaccination, a fourth vaccine of parvovirus for dogs such as Rottweilers, Doberman Pinschers, German Shepherds, and sometimes the pit bulls are affected as well. So keep that in mind. Symptoms of parvovirus infection are fairly profound. First thing that's important for all pet owners is to know the average temperature or the range of temperature of your dog. And it's 37.5 degrees Celsius to 39.5 degrees Celsius. It's a range, and that's because dogs will adapt their temperature somewhat, and many mammals do this actually, adapt their temperature to their surroundings. If your dog has any illness, lethargy, off food, vomiting, diarrhea, whatever, and you take a rectal temperature and say it's 39.3, it's time to get veterinary attention, because how do we know that temperature isn't going to climb? So back to specifically parvovirus. Parvovirus typically, because it attacks the gastrointestinal system, we typically see dogs that just basically go off their food and become lethargic. But it quickly progresses. I should back up and say that it takes 3 to 7 days for the virus to really manifest itself. And initially, the dogs are just lethargic and off food, maybe weak. But then it progresses to diarrhea, then bloody diarrhea. Then the dog starts vomiting. Then the dog typically develops profound lethargy, weakness, and a fever. And the problem with the fever stage is, yes, a fever is over 39.5 degrees Celsius, but if you leave it too long, the dog may actually go hypothermic, and the temperature become both either normal, or normalized, you might say, or below normal. So that can be misinterpreted by some owners if they're doing home temperatures. Sometimes we'll see abdominal bloating. I haven't seen that too much, but the key here is dehydration of your puppy or your adult dog becomes profound, and then their ability to fight the infection off is compromised, and you get a rapid deterioration, and you need to get emergency, timely veterinary care. Once you're in the exam room, be prepared that the veterinarian is going to want to do some, after the initial exam, and a consultation and a discussion of the dog's past vaccination history or any other thing you want to bring into the conversation. Blood work, complete blood count, blood chemistries, electrolytes, and a parvo test. There's 2 types of parvo tests to really think about. The one that most clinics use is called an ELISA, ELISA, enzyme-linked immunosorbent assay. It's a quick test where a swab is placed up the dog's rectum for a sample of feces and run to see if the parvovirus is in the fecal matter. If that is false negative, sometimes you'll hear what's called a PCR, or polymerase chain reaction test for parvovirus, basically to back up if the SNAP test or the ELISA test is considered false negative. After that, you can expect the blood work to be reinterpreted. I've seen emergency clinics lately doing x-rays and or ultrasounds because maybe they're on a path of what is going on. We don't really understand the blood work we're getting. We're certain the dog has parvo, but there are other possibilities that can cause intestinal upset and bloody diarrhea. Anyway, treatment. Let's just say the dog is tested positive for the parvo booster. The goal is to manage the symptoms, maximize supporting the dog's immune system, rehydration, and ensuring no secondary infections occur. Hospitalization is part of that. It can be a few days, if not up to a week, depending on the severity of the infection. The dog will be isolated from other dogs, and we'll get to environmental sanitization in a minute. Basically, you can expect your dog to be on IV fluids to replenish electrolytes, replace the fluids lost due to the infection itself. To that, they're going to add antibiotics. And some of you out there might go, why would you treat a virus with antibiotics? Because we need to ensure no secondary infection occurs. Typically, those are contracted through the bowel because the cells of the bowel are so damaged. And it's pretty profound sometimes. Don't be surprised if your veterinarian repeats the complete blood count or the CBC 1 or 2 or 3 times to ensure that your puppy dog is responding to treatment and not getting a secondary infection. So IV fluids, covering or secondary treatment of antibiotics, drugs to stop the vomiting called antiemetics. Some dogs need pain management. I'm not completely convinced every case does. I try to treat each case as an individual. Nutritional support will start, which is feeding your puppy or your adult dog nutrition once the vomiting is controlled, once the diarrhea is becoming under control. Then it's important we get nutrition that's absorbable by the bowel into your dog to help them move them faster along the recovery process. I have seen at the emergency clinics here doing plasma transfusions, basically giving antibodies to your dog if the clinicians there feel your puppy is not responding as aggressively and as quickly as they need to. Keep in mind the prognosis is 80% of dogs will get better and live perfectly normal lives. I've seen studies going down to 75%, so 2.5 out of every 10 dogs don't make it. I've also seen it being 9 out of 10 dogs are fine, so 1 out of 10 dogs don't make it. The key is it's still a pretty significant loss of puppy dogs. So now you've taken your dog to the veterinarian. What are you going to do at home? While you're waiting for your dog to recover and you're going to go back and forth and visit your puppy, we need to sterilize the environment and try to figure out where maybe we contracted, or not we, but your puppy dog contracted the disease. You need to use bleach in a 1 in 30 solution or dilution. And so you have to consider the fact that you cannot, and this is hard because I've seen it, where clients have got a new puppy. Maybe the breeder told them it was vaccinated, maybe not. They bought those new first puppy toys, that new bed, maybe that new carrier. It's such an exciting time. God, you love dogs, right? You love puppies, kittens too, baby birds. Baby animals generally are beautiful. But having said that, it's so hard to have to tell clients this, but throw away the puppy toys. Throw away the bed. Throw away things that you cannot or will not withstand the bleach treatment. Yes, there are accelerated peroxide treatments. They're pretty harsh too. So you need to get rid of anything that you can't clean thoroughly. We term things that spread disease or that viruses live on as a word called fomites. So stainless steel dog bowls, which is the way you should be giving your dog and cat their food, is stainless steel dog bowls, easily cleaned, easily sterilized. You're going to clean those with the bleach solution. Keep in mind, if you have children in the house, they're going to have pet the dog and spread it to light switches and doorknobs. So you're going to need to consider cleaning everything you can, not obsessively, but thoroughly. Then steam clean the rug, steam clean the furniture. You need to go outside and pick up after your dog. People should be picking up after their dogs regularly, but let's be straight, we know that doesn't happen. So you need to pick up after your dog. And then I've read on the internet or watched on the internet some veterinarians, some that are not practicing for various reasons, maybe some that are, that say UV light kills the virus. That is true. What they don't say, and again, one of the reasons I've started this channel, is that it's very difficult for sunlight to get deep into your grass, deep into the woods where a dog has defecated, even up to 7 years previously. That virus is very hardy and survives freeze-thaw cycles. So cleaning up and picking up is imperative, but you can't deal with everybody else's mistakes either. Generally, because vaccination is the prevention, the best defense, you need to also consider not taking your puppy anywhere where it could be coming in contact with dogs who may not be vaccinated, maybe never vaccinated. And so one thing to consider is, in addition to disposing of bedding and toys and, reminding the children to thoroughly wash their hands and you clean the home, now we have to figure out how we're going to avoid the next infection. I'm going to backtrack a little bit and say, let's just talk about vaccines, the definitive defense against parvovirus. Basically, puppies should receive a series of 3 combination vaccines of distemper and parvo. I won't get into all that, but let's just say you need a parvo booster for your puppy at 6 to 8 weeks, 10 to 12 weeks, 14 to 16 weeks. And again, the discussion of the German parvo booster, as I've seen it quoted, is at 20 weeks. Anyway, that first shot, some clients will say, well, why do I have to vaccinate my dog 3 times? Can I just get away with 2? My child or baby only got 1 or 2 inoculations. That's because if your breeder was responsible, your puppy's breeder was responsible and had their dog, the mom dog, vaccinated about a month before they conceived, then they will have passed on what's called passive immunity in the milk to the puppies for parvovirus and some other viruses. The trouble with that is that if your breeder was super responsible and everything went well, then the first vaccine will be fought off, if you will, neutralized by the passive immunity that the mom transmitted to the puppy. However, passive immunity doesn't have any longevity, doesn't have any what we call memory. So we need to boost 3 times to kind of make sure that if the flip side has occurred, the breeder maybe wasn't responsible, maybe the mom didn't mount a great immune response to the vaccines that the breeder did give. Unfortunately, some breeders don't get their dogs vaccinated at all. Your puppy is naive, what we call unexposed, unable to fight off the vaccine. Then those 3 vaccines together cause no harm and prevent parvo and distemper. Rabies is given at 16 weeks, 14 to 16 weeks, by the way. There is some misinformation on the longevity of vaccines. And all I'll say there is our policy. Years ago, one of the reasons I opened up Sunnyview, and there were many, is I disagreed with clinics that were vaccinating all vaccines all the time, every year. That clearly hasn't been necessary. There have been studies that do show that dogs with proper immunization, proper nutrition, proper health can mount a very effective immune response and can gain at least 3 years from distemper and parvo vaccines. But that's presuming all 3 puppy vaccines went well. You had everything reboosted at 1 year of age. And then what Sunnyview's policy is to vaccinate parvovirus 1 year, the next year distemper virus, the next year rabies. That gets the dog to 4 years of age. We recommend that you then do distemper, parvo, rabies another once every 3 years. So in year 5, your dog is getting parvovirus, year 6, distemper, and so on. By the age of year 10, though, I don't think we need to do that as much. And so that's where you get these conversations of titers, which I'll touch on in a moment. But you'll also have clients say that, well, my dog had parvo, survived, so I don't need to vaccinate. There's some truth in that, but the problem is with titers, vaccine longevity, and those sort of studies, which some of them have been they've done the best they can, but they're still not 100% accurate, is because to truly test a vaccine, to truly test a dog who's been exposed to parvovirus and survived, you need a control study. And without getting too deep into the studies, you need a control group of non-vaccinated dogs, all of the same breeding, all of the same species, so to speak, then a group that's been vaccinated maybe to test it thoroughly. Maybe some of these puppies only got their first booster of 3. Some of the group got 2 boosters of 3, and so on and so forth. It becomes a very complicated study. But the key here to truly test this, or animals that you draw blood on for the titers, and you look at what's called the dilution, I can't think of the word right off the top of my head, but basically the effective dilution ratio, you have to give the dog parvo to find out if it worked. Nobody's going to do that because there'll be some dogs who will pass away. So the studies are very good, but not perfect. So let's talk about moving past, I guess, the idea that does your dog need vaccinations or not. I'm going to say, and Dr. Hubert Bennett, who's long gone, and another mentor vet of mine, both said at different times during my pre-veterinary and veterinary career, vaccines have saved more dogs than they've ever harmed. And when it comes to parvo and distemper and rabies vaccine, they're so effective with so minimal reactions or adverse reactions, whatever word you want to use, it's not worth not considering it. But every year, have a consultation with your vet, talk to your veterinarian. Nutrition is another one that's open to a lot of communication. So concluding, basically, we talked about vaccines. So what do we do about titers? Well, when you run a titer, it would be for a senior dog that's basically 9, 10 years of age or older. They've done 3 rotations of the Canine Parvo, Canine Distemper, Canine Rabies series. And you're like, you know what, I want to talk about titers. They're a little more expensive than vaccination, and rabies titers are extremely expensive. So if your dog has a vaccine sensitivity, that might be a time to consider titers. A dog that's immunocompromised or has autoimmune disease, which is very serious. I already mentioned senior dogs. And for those owners that prefer a minimal vaccination approach, it's fine. But if the titer ratios are low, you have to consider revaccination. And here we go about personal stories. When I was in vet school, I was given the rabies vaccine. I didn't react well to it, though it wasn't horribly bad. They ran titers on me. My titers were actually unusually high, which they shouldn't have been. But to this day, my titers still remain high, and I can't get professional veterinary medical insurance in case I get rabies. So that kind of contradicts the simplistic look at, well, if the titer ratio or the titer levels are low, you have to vaccinate. And if the titer levels are high, you don't have to. There's a sweet spot. And let's just leave it at that, that even too high is not necessarily protective. In the end, it's a devastating disease, easily controlled with proper vaccination. Pick up after your dog. Just perform good hygiene. If your dog is ill, or your friend calls you and says their dog is ill, prompt veterinary attention, or intervention might be a better word. Just understand the importance of considering vaccination, the roles that titer testing may play, sanitizing the environment after the infection has occurred. Just consult with your veterinarian for your dog or cat about what vaccine schedule strategies are good for you. I hope I've covered everything. I do apologize if I spoke too quickly. Thank you for your time. Like and subscribe. I'll leave a list here of just a summary off over my right shoulder typically, and I'll put something in the comments section. Give me some feedback if you want to see another subject covered, and I'll do my best to do so. I'm going to endeavor to get a show out every 2 weeks. So like and subscribe. Thank you for your time. Kindness is our best weapon. Be kind to each other. Be kind to your pets. We're so fortunate to have dogs and cats and other animals in our lives, aren't we? Have a great day.